make sure that it's open all the way across, and really use your whole hand to roll it down. I want you guys to remember you don't have to rush this. You can take your time to do it properly. So use your whole hand to break that top seal, and then slowly roll down. And I want you guys to keep in mind that once you touch the inner portion of this packaging, it cannot touch the inner packaging. You've contaminated it now with your hands, and if you let it go back on, you're contaminating the inner package. You've broken sterility. Fail. So crunch it up in your hands as you peel it down. And you guys need to peel it down until you're at a point where you can control set it on your surface. When you're shaking things, there's a lot of air particles moving around, there's a lot of bacteria, there's room for stuff to get in your sterile package. You don't want to shake anything, packages, hands, when you're working in a sterile field. What can I do with this right now? Literally drop it. Don't let your hands fall, ever. Drop it. We can deal with it later, we'll pick it up later. So now that my inner sterile glove packaging is prepared for me, I'm gonna leave my area and I'm gonna wash my hands. I'm gonna do a sterile hand scrub the way that you guys have learned. Each finger, all the nails, all the surfaces of the hand, and then I'm gonna dry with a sterile towel. You guys will learn later on how to use a sterile towel to dry. You'll kind of use one half of the towel for one hand and then pick it up and totally flip it and dry the opposite hand. What's gonna happen with the towel after? Drop it, right? So now my hands are as sterile as they could be. I'm gonna reapproach my gloving station. So at this point, if your hands drop below your waist or the table at all, you've broken sterility. You cannot touch the table at all. It is a clean table, it is not a sterile table. So when you're opening this package, if it's folded to the point where you're nervous about actually grasping the top piece like this, then you can pinch the top. You can pinch the top and open it like this. Obviously, make sure it opens all the way. Once it's here, you can no longer touch that bottom surface that has touched the table. So I want you guys to make sure it's oriented correctly, facing in the upwards direction with the left and the right on the left and the right. At this point, I want you guys to give some care to opening this part of the package. So when I do this, I do the top and the bottom first. I really try to get rid of that little crease that happens. You want to make sure you're also not touching the gloves in the middle open section. So top, bottom, kind of get rid of those seams, and then go ahead and grab your two side tabs. Right here is where your gloves can get stuck. So watch my fingers, the motion that I do right here. And you see how I'm rolling on the package to make the gloves get unstuck from that package. Once I know the gloves are not stuck, I'm gonna open this all the way. So I really use tension to help the package lay down flat, and I do not take pressure off of the package until I'm confident that it's not going to fall back in on itself. If I've touched this and it folds back on the gloves are contaminated. Your sterility is broken. Now I'm confident my packaging is gonna stay where it is. I can start to glove. So I'm going to pick up my first glove with my opposite hand. I like to, do you guys see what I just did there? You have another hand you can use. If your gloves get stuck together, I would rather you hold this down and remove the glove than be dangling the other glove and the package around just because it's stuck, right? So hold it down and separate your glove. Once you have that first glove, I'm going to suggest take a peek behind you, step back, do not drop your arms. Make sure you have a good grip right here. A lot of you guys are barely grasping that or grasping it on the top. I go inside with my thumb and then have a really good grip with my other two fingers so that I have a lot of resistance to pull my hand in. I'm gonna put it on as best as I can right now, and I'm gonna leave that cuff folded. When I'm ready for my second glove, you don't have to worry about this hand yet, but if you can at all fix it quickly, you can, just like I did a little bit. My gloved hand can only touch the fingers of my second glove. I can use that to hold it down. If this part is stuck, I can use my ungloved hand to pinch a little bit and start to separate those two parts of the glove. Grab the thumb, make sure that is separated as well. And right here, you guys can be fairly rough with these gloves, but you have to avoid using your fingernails. If you pinch that cuff with your fingernails and pull, you're going to rip the glove. Once you have enough space to safely insert your hand into the cuff, you may do so. And I'm going to suggest to you guys to try to get your thumb in there, because what a lot of you guys were doing is, first of all, you're using your index and your thumb to pick up the cuff right here. That's a break of sterility. The second thing you're doing is putting your fingers under and then grabbing right here. That's a break of sterility. If these fingers can't touch this part, then neither can this one. All of this is the same. So underneath that cuff, if you can, get your thumb in there, peek back, step back, a lot of resistance. Put that second glove on the best that you can, and pull this cuff on your second glove all the way down. Fix it as soon as you put your glove on. I am safe right here to touch these two gloves together, so I'm gonna go ahead and fix my finger real quick so that I know I'm not going to contaminate my other cuff. Then when I feel confident to use this hand, I'm going to go underneath my cuff, create some tension, fix my first glove's cuff, and on this part, you guys don't have to snap your gloves, because a lot of the time what's going to happen is the cuff is going to roll back on itself. So if it had just been folded and I'm going to fix it, I can pull down. You can create a lot of tension right here, but you don't have to release it with that tension. You can slow it down so that it stays where you want. And then if you're going to go back and fix this glove, you may, but stay away from the edges. You're risking possibly touching your arms. And if you touch your arms, if you touch the edge of the table, the outside of this packaging, your original packaging, all of those are going to be breaks in sterility. So that is how we sterilely apply our gloves. And if you guys have questions, let me know.